All right. Okay. Thank you so much po for your response. Okay. Thank you po. So let's begin. This presentation contains our discussion on Chapter 15. So the Streptococcus species, Enterococci, and other Streptococcus-like organisms. And po, so here's the outline of our discussion, and let's begin with the general characteristics. So some species, actually a lot of them, are part of normal flora of humans. So most members of Streptococcus and Enterococcus, they may behave like facultative anaerobes, but they are actually aerotolerant anaerobes. And po, so some species are capnophilic, which would require increased concentration of carbon dioxide, whereas the growth of other species is stimulated by increased CO2 concentration, but it is not required. So bale, nakadepende din po on certain species or strains if they would require increased CO2 or not. Microscopically, they are gram-positive cells that are arranged in chains, just like this one. Ayan, in this photo at the bottom right corner or bottom left corner. Ayan po. So, microscopically, they are cocci in chains, but macroscopically, their colonies are grayish, pinpoint, or small, and they may be translucent as shown here in this picture. So, ayan po. Hindi katulad ng Staphylococci na catalase positive, ang mga Streptococci po ay catalase negative. So one similarity between them is that they are both non-motile, so they don't have any form of flagella. Two of the most notorious pathogens from this genus is Strep pyogenes and Strep pneumoniae. Let's now go through the different classifications of the members of the family Streptococcaceae. So first is the Burgess or academic classification, which is simply based on the optimum growth temperature. So this is rarely used, kaya pa we won't go through this in detail anymore. But basically, yung biogenic group, they usually only grow at 37 degrees Celsius. Viridans group will grow at a range of 37 to 45 degrees Celsius. Lactic group, 10 degrees Celsius hanggang 37 degrees Celsius. And the Enterococcus group, ito po, they have the widest range of optimum growth temp. So they can grow at 10, 37, and 45 degrees Celsius. Next is the Smith and Brown classification. So this is based on their hemolytic patterns. Now, if a bacteria is alpha hemolytic, this means that they're only capable of partial hemolysis or incomplete hemolysis of the erythrocytes in the blood agar plate. So alpha hemolysis would produce a greenish discoloration around the colonies on BAP, as shown right here. So one example of an alpha hemolytic strep is Streptococcus pneumoniae. If a bacteria is beta hemolytic, this means that they are capable of complete hemolysis or the total destruction of the RBCs that are present in the medium. So beta hemolysis could produce a clear zone around the colonies, and ganito po yung itsura nun. So an example of beta hemolytic strep is Streptococcus pyogenes and also Streptococcus agalactiae. If a bacteria is gamma hemolytic, this simply means that they are non-hemolytic. So they can't lyse any of the RBCs in the culture media, not even partially. So we rarely use this term nowadays. Kadalasan po, we just say that the organism is non-hemolytic. So they will produce no change in the surrounding RBCs, and an example of this would be Streptococcus bovis. Next is the Lansfield classification, which is based on a serologic method that depends on the polysaccharide antigens that are present on the streptococcal cell wall. And this is the most commonly used method of classification. So, yung flow po nung discussion natin will also follow the Lansfield classification. So group A strep includes Streptococcus pyogenes and all its strains and serotypes. Group B Streptococcus includes Strep agalactiae and all its strains and serotypes. Group C includes Streptococcus dysgalactiae and equi. Group D includes Streptococcus bovis group plus the Enterococcus species. Here in the Landsfield grouping, ang strep pneumo po, it doesn't belong to any group. Okay, so kung Landsfield classification yung susundin, and we would characterize them by their streptococcal cell wall, it would not belong in any of the groups. And lastly, we have the viridans streptococci. So yung iba po dito, like the anginosus group, they may also be referred to as the group G strep. All right, so now that we know the general characteristics of streptococci and how they are classified, let's discuss each clinically significant species. First up is Streptococcus pyogenes, or the group A Streptococci. This has been known as a colonizer of the skin and throat of humans, making these sites the primary sources of transmission. So either by inhalation of contaminated droplets in cases of pharyngitis, or pwede rin naman pong skin contact in cases of pyodermal infections. Their colony morphology on BAP appear to be small, translucent, and beta hemolytic, as shown here on the photo to the left. Ayan po. So notice that there is a small amount of light that is passing through the colonies, kaya po natin nasabi na translucent sila. And also, it's quite apparent that they have a cleared out zone or they have cleared out the zone of RBCs in their immediate surrounding. Okay, which tells us that they are beta hemolytic. Let's now look into the virulence factors of strep pyogenes. So the following virulence factors are similar in a way that they are structural. So ang ibig sabihin po, these virulence factors are not something that the bacteria produces. Rather, naka-incorporate na po siya dun sa mismong structure ng cell walls nila. First is the M protein. This is attached to the peptidoglycan of the cell wall and would extend to the cell surface. Okay, so di ba po, gram-positive bacteria, such as streptococci, they also have thick peptidoglycan layer. But for strep pyogenes po, what makes them special is that they have the M protein. So the M protein molecule causes the streptococcal cells to resist phagocytosis. And this also plays a role in the adherence of bacterial mucosal cells. So there are more than 200 different subtypes or serotypes of the M protein. Next is the fibronectin binding protein. The fibronectin binding protein, or the F protein. So this helps the bacteria attach better to epithelial cells. Ang lipoteichoic acid naman po, it's also for adherence, specifically to the respiratory epithelium. And last one is the hyaluronic acid capsule, which prevents the opsonization and phagocytosis by neutrophils and macrophages. So this capsule also allows the bacterium to mask its antigens and remain unrecognized by the host immune system. So kumbaga, ito po yung nagiging disguise nila para hindi sila ma-recognize ng mga phagocytes natin. Do take note, though, that not all streptococci possesses a capsule. So, ayan po. All of these are their structural virulence factors. These next virulence factors are referred to as hemolysins. Okay, so these are the ones that are responsible for the beta hemolytic activity of Streptococcus pyogenes. First is SLO, or the streptolysin O. So this is an oxygen labile hemolysin, which means that it could only produce hemolysis under anaerobic conditions. So either you incubate the culture anaerobically or by stabbing the agar. So ito po yung mas common na practice in the laboratory. If we would like to check if the isolate can produce SLO, after completing all the 4 streaks, you may proceed to stabbing the agar with the inoculating loop. So ayan po, you may do this multiple times on different areas of the agar. Now, stabbing the agar would create an anaerobic environment para dun sa mga bacteria na may inoculate dun sa mga stabs na yon. Kasi po, ang oxygen naman, it will only be present on the surface of the agar. So it can't diffuse through or it can't penetrate the inside of the agar or the deeper layers of the agar. Kaya, ayan po, even without incubating the agar anaerobically, we can produce an anaerobic environment for the bacteria to grow just by stabbing the agar. If subsurface hemolysis is observed, so kapag nakita po kayo ng hemolysis in those areas where the stab was made, then this means that the streptococcal isolate can in fact produce SLO, and this may possibly be Streptococcus pyogenes. Take note that SLO is highly immunogenic, meaning our immune system can produce antibodies against this. And ito po yung basis ng diagnostic test na anti-streptolysin O or the ASO titer. So ASO is a test to determine whether a patient has had a recent infection with strep pyogenes. Next is streptolysin S. So kabaliktaran po ng streptolysin O, streptolysin S is non-immunogenic. So our immune system wouldn't produce antibodies against this. Also, this hemolysin is oxygen stable. So ma-observe pa rin po natin to without stabbing the agar because it can cause surface hemolysis. So again, kapag surface hemolysis po, this is caused by streptolysin S. Pero kapag po it is a subsurface hemolysis that can be observed only by stabbing the agar, yun po is produced or it is caused by the streptolysin O. On to the next virulence factors, streptokinase. So streptokinase causes the lysis of fibrin clots by acting on plasminogen. Okay, so ayan po. Plasminogen together with streptokinase can be converted to plasmin, which can now lyse or destroy fibrin clots. Next are streptococcal pyrogenic toxins, formerly known as erythrogenic toxins. So they are responsible for the toxins that form during the cases of scarlet fever. So there are 4 immunologically distinct or 4 different serotypes of pyrogenic toxins that may be produced by strep pyogenes, and these are SpA, SpB, SpC, and SpF. So these toxins function as super antigens. So they can stimulate T cell or T lymphocyte proliferation, which would lead to increased production of cytokines, and that can mediate the disease process. So bali po, sa mga pyrogenic toxins na to, because of them, nag-overreact yung immune system ng pasyente, which would lead to the production of other symptoms plus the rashes. Next is hyaluronidase. So this virulence factor po, nakilala niyo na rin po ito, di ba? During our discussions on staphylococci. So hyaluronidase, or the spreading factor, this is an enzyme that solubilizes hyaluronic acid. This may then cause the separation of tissues and further spread the infection. Last one is DNase, which also is something na napag-usapan na po natin last meeting sa staphylococci. DNase functions the same way as those that is produced by Staphylococcus species. Okay, now that we know the virulence factors that are produced by Streptococcus pyogenes, tignan na po natin yung mga infections and diseases that may be caused by strep pyogenes. So the most common clinical manifestations of strep pyogenes is bacterial pharyngitis and tonsillitis, commonly referred to as strep throat. So most cases of strep throat may also be caused by some species from the group G and group C streptococci. So may capabilities din po yung mga yon to cause significant acute pharyngitis. Kaso lang po, they are less commonly seen. Okay? So, ayun po. Ang pinaka-kilala talaga na causative agent ng strep throat is Streptococcus pyogenes or the group A streptococci. So after the incubation period of 1 to 4 days, an abrupt onset of illness would ensue, which includes sore throat, malaise, fever, and headache. So the tonsils and pharynx are inflamed, and the cervical lymph nodes are swollen and tender. So upon physical examination po with the doctor, possible po na makapaan ng doctor yung lymph nodes nung pasyente sa leeg dahil po namamaga sila. So minsan po, there may also be symptoms beyond the respiratory tract, such as nausea, vomiting, and abdominal pain. So these disease ranges in intensity, and some of these symptoms may not be seen. Okay, so iba-iba rin naman po yung disease manifestation per patient. So pwede yung iba po mild symptoms lang, while the other patients could present all of those symptoms that I've just mentioned. Now, these symptoms would subside within 3 to 5 days unless complications would occur. Next is rheumatic fever. So, rheumatic fever typically follows strep pyogenes pharyngitis. So, kadalasan po this happens or this develops after an infection with or after the development of strep throat. Okay, so it is characterized by fever and inflammation of the heart, joints, and blood vessels, and even subcutaneous tissues. So symptoms usually begin within 1 month after infection. So 1 month po after pharyngitis, and even after the patient has already recovered from pharyngitis, they may still be at risk of developing rheumatic fever. So the most serious complication of this is chronic progressive damage to the heart valves. Repeated infections can produce further valve damage. So kadalasan po ito yung nagiging consequence para dun sa mga pasyenteng paulit-ulit na nagkakaroon ng strep throat. So the pathogenesis of this or the pathogenesis of rheumatic fever is due to the antigenic cross-reactivity between streptococcal antigens and the heart tissue. So ang problema po kasi dito, yung mga antigens ng strep pyogenes, merong similarity in structure with cardiac tissues. So yung mga excess na antibodies na produce during the course of infection with strep throat, nire-recognize din po nila yung mga cardiac tissues as antigens to be acted upon. Okay? So akala nung immune system, kalaban din yung cardiac tissues. So kahit magkahawig lang naman sila nung streptococcal antigens. So this would lead to tissue damage. Kasi ngayon po, ang ina-attack na ng immune system ng pasyente is yung cardiac tissues. Next is acute glomerulonephritis or AGN. So acute glomerulonephritis may occur after either a cutaneous or pharyngeal infection. Okay, so kadalasan po AGN would happen, again, also after a previous infection. So the pathogenesis appears to be immunologically mediated. So circulating antibody complexes or antigen-antibody complexes in the serum of patients with AGN has been noted. So these complexes would deposit in the glomeruli. So di ba po, one of the functions of the human kidneys is to filter blood. So again, if may natira po sa bloodstream ng pasyente na antigen-antibody complexes from the previous infection, these may be deposited or they may get stuck in the glomeruli as the blood passes through the kidneys. So ngayon po, since napansin nung immune system natin na naipon doon yung mga antibodies, iisipin tuloy ng immune system na nandun yung kalaban sa kidneys, which would also lead to the impairment of kidney function. Kasi po ngayon, ang ina-attack na ng immune system is yung glomeruli ng kidneys. Do take note that both rheumatic fever and AGN are both post-streptococcal sequelae, meaning they develop after a previous streptococcal infection. Okay? So meron muna pong naunang strep infection yung pasyente that led to the development of these diseases. All right. Now, infections with strains of Strep pyogenes that produce streptococcal pyrogenic exotoxins can result in scarlet fever. So, after the incubation period of 1 to 2 days, a diffuse red rash appears on the upper chest and would spread to the trunk and extremities. So, the rashes would disappear over the next 5 to 7 days, and this is followed by desquamation. Ayan po. So there are exanthems and erythemas. We can see here in this first photo. So this is an example of a patient suffering from scarlet fever. Next, the following diseases are all recognized as pyodermal infection. So first up is impetigo. This is a localized skin disease and begins as small vesicles that progress to weeping lesions. So the lesions would crust over after several days. Okay, so as you can see in this second photo, this is an example of a patient suffering from impetigo. Next is cellulitis. Cellulitis can develop following deeper invasion of streptococci. So there is erythema and edema. Okay, so meron pong redness and swelling. The infection can be serious or life-threatening if bacteremia or sepsis would follow. The third photo is what cellulitis looks like. So ito po, an example of cellulitis. Last pyodermal infection is erysipelas. So erysipelas is a rare infection of the skin and subcutaneous tissues that is observed frequently in elderly patients. So it is characterized by an acute spreading of skin lesions that is intensely erythematous. So very red po yung mga areas that are affected with a plainly demarcated but irregular edge, as we can see here in this picture. So malinaw naman po na nakikita natin kung saan kung saan nag-start and kung saan nag-end yung bawat lesions. Pero yun nga po, the edges are irregular. So walang exact shape yung lesions ng pasyente. Next is necrotizing fasciitis. Necrotizing fasciitis is an invasive infection characterized by rapidly progressing inflammation and necrosis of the skin, subcutaneous fat, and muscle fascia. So this one goes way beneath the surface to the point that it can literally eat away the patient's flesh, which is why this is also being referred to as the flesh-eating disease. This is a life-threatening disease, but death can be prevented if early intervention is done. So the mortality rate may reach greater than 70% if the infection is left untreated. In some cases po, the entire limb is amputated. So in some cases, yun na lang yung natitirang solution to save the patient kasi wala na pong antimicrobials that could work against the infection. Kaya po, they just end up chopping off the entire limb. Now, depending on which organisms are cultured or which organisms have been determined to cause the infection, necrotizing fasciitis may be categorized as either type 1, 2, or 3. A polymicrobial infection from which both aerobic and anaerobic bacteria are recovered, is characterized as type 1. So kapag multiple organisms po yung causative agent, that is type 1. Type 2 necrotizing fasciitis po if only group A strep is the causative agent. And type 3 is gas gangrene or the clostridial myonecrosis caused by Clostridium perfringens. Next, group A strep has also been associated with streptococcal TSS. So these are the strains responsible for this are those that can produce the pyrogenic exotoxins, specifically SPA. Okay, so these toxins are likely the reasons, or they're most likely the ones that play a major role in the pathogenesis of this disease, functioning as super antigens, leading to the overstimulation of immune response, resulting in resulting in excessive cytokine production. So again, nabanggit ko po kanina, di ba? Excessive cytokine production is bad. Okay, so this is like the overreaction of the immune system, which could affect other organ systems and do more harm than good. Streptococcal TSS is a condition which the entire organ system would collapse or shut down, which would lead to death. So the initial streptococcal infection is often severe. So pwede pong magsimula as pharyngitis, cellulitis, peritonitis, or wound infections. And the symptoms that develop are similar to the symptoms of staphylococcal TSS. Okay? So patients are often bacteremic, and minsan po, yung mga patients that have necrotizing fasciitis, they may also develop TSS or streptococcal TSS. So kasama po yun sa mga reasons as to why necrotizing fasciitis became a life-threatening disease. Kasi po, maliban dun sa mismong infection, ayan, minsan po nagpo-progress din siya to streptococcal toxic shock syndrome. Okay, let's now proceed to laboratory diagnosis. So first up is taxo A, or the bacitracin susceptibility. So this would help us differentiate strep pyogenes from all other beta hemolytic strep, specifically from throat cultures. And po, so specimen of choice for this are throat swabs. Now, with the use of an antimicrobial disc containing 0.04 units of bacitracin, if the isolate is a group A strep, then this should give a susceptible result. So magkakaroon po ng zone of inhibition around the disc as shown here. Ayan. So kaya po siya tinawag na taxo A kasi this is usually po, group A strep lang po yung beta hemolytic streptococcus species na magpa-positive dito po sa taxo A, or sila lang yung susceptible sa bacitracin. Next is PYR, or the pyrrolidonyl R-lamidase test. So this is actually more specific than taxo A. It can detect the presence of PYR enzyme produced by strep pyogenes, and a positive result is indicated by the production of a cherry red color after adding the detector reagent. So ayan po, if we would look at this tube, di ba, ayan po, yung solution sa ibaba, it's clear, and then on top of it, ayan po yung cherry red product. So again, that's for the PYR. Okay, proceed na po tayo with Streptococcus agalactiae, or the group B streptococci. So all strains of S. agalactiae have the group B specific antigen, which is why sa Lancefield grouping po, sila yung group B streptococci. Now, they may be found as part of the normal flora of the lower GIT and genital tract. All right, so its primary virulence factor is its capsule, which is composed of sialic acid. So this capsule prevents the phagocytosis, but this capsule may also become ineffective after opsonization. Okay? So although nakakatulong po yung capsule niya in avoiding phagocytosis by masking its surface antigens, ayan po, if they ever encounter any free antibodies that ends up covering them or opsonizing them, then wala din po. Okay? So opsonization would render the capsule useless. Strep agalactiae has been associated with many different nosocomial infections, but the most notable out of these is neonatal meningitis. Okay, so the colonization of the vagina and rectal area with group B strep is found in 10 to 30% of pregnant women. So, dun po nakukuha ng neonates yung infection. And most infections of infants would occur in the first 3 days after birth. Usually po within 24 hours, ayan po, mag-start na yung disease manifestation ng neonatal meningitis. Okay, let's now look into the laboratory diagnosis that would help us identify strep agalactiae. So group B strep colonies on BAP or SBA are grayish-white mucoid colonies that are surrounded by a small zone of beta hemolysis, as we can see here on figure 15.5. Now, upon gram staining, we'll be able to observe gram-positive cocci in short chains. So, short chains lang po kung diretso galing sa clinical sample yung gram stain natin. But they may appear in longer chains if the colonies were taken from culture, as shown here in these photos. Okay? So, ito po. This first photo, most likely po galing to sa directly taken from clinical sample kasi po aside from the fact that may igsi yung mga chains nung cocci na nakikita natin, meron din pong may mga excess background materials tulad itong mga pink materials na nakikita natin sa background that doesn't really have any form. Okay, so ayan po. So most likely pag ganyan po yung itsura, possibly galing po siya directly from the clinical sample. And ito naman po, most likely itong nasa right, yan po yung mga picture, ito yung examples of images in gram staining that has been directly taken or that has been taken after culturing the sample. Kasi ayan po, wala nang extra na mga background materials and mas mahaba na po yung itsura ng mga chains ng cocci. Next is the CAMP test. So this can differentiate strep agalactiae from other beta hemolytic strep. So we could either use a beta lysine strep or an organism that produces beta lysine like Staph aureus. So the principle behind this is that certain bacteria such as group B strep can produce extracellular hemolytic factor known as the CAMP factor. Now, this CAMP factor can act synergistically or can work together with the beta lysine that is produced by Staph aureus, causing an enhanced hemolysis. Okay, so what we're going to do here is that we will streak the suspected group B strep isolate perpendicularly to the Staphylococcus aureus streak. So a positive reaction is indicated by an arrowhead zone of hemolysis or a bow tie shape of hemolysis dun sa area kung saan nagme-meet or naglilink yung dalawang streaks, as you can see here in these pictures. Next is hippurate hydrolysis. So hippurate hydrolysis is also very useful to differentiate strep agalactiae from other beta hemolytic strep. So if the bacteria produces the enzyme hippuricase po, this can hydrolyze hippuric acid to glycine and benzoic acid. Ngayon, yung glycine po na na-produce through that reaction, this can be detected after the addition of ninhydrin. Okay? So, this would form a purple colored product as we can see here in this picture. So yan po yung positive result. Again, hippuricase could hydrolyze um, hippurate to hippuric acid or ayan po. Tapos it would produce glycine and benzoic acid. Okay? Tapos ayun po, yung glycine na mapoproduce ng reaction na yon, this could be detected by ninhydrin which would produce a purple color. Moving on to the next group, we have group C and group G, streptococci, which are subdivided into large colony and small colony forms. The large colony forming beta hemolytic isolates belong to this Agalactiae subspecies Equisimilis, and then the small colony forming beta hemolytic isolates belong to the S angiogenosis group, which is also included as a virulent streptococci. Now, clinical infections of Strep dysgalactiae subspecies Equisimilis, although they are very uncommon, they have been involved in several body sites, as we can see here in this list. Okay, so the spectrum of infections may resemble strep pyogenes and includes upper respiratory tract infections, skin infections, soft tissue infections, and even the invasive infections such as necrotizing fasciitis. So yung mga diseases po associated with Group C and Group G streptococci, minsan po pwedeng parehas lang sila ng mga kayang idulot na diseases ng strep pyogenes. Ang difference lang po is that these are very rare. So rare lang po na yung mismong Group C and Group G strep yung causative agents. So ayan po. Next is Streptococcus pneumoniae. Okay, so next species po, Streptococcus pneumoniae. This is actually a member of the Streptococcus mitis group, which is also under the viridans strep. Pero po, it is much more virulent than all the other members. And yun nga po sa Lansfield grouping, hindi belong sa kahit anong classification yung cell wall ng strep pneumoniae. Kaya po, nakahiwalay siya ng discussion. So strep pneumo can express one out of approximately 90 different polysaccharide capsules or 90 different capsular types based on their polysaccharides. So yun po, that is strep pneumo's primary virulence factor, its polysaccharide capsule. The antibodies that are directed against the capsular antigen is protective, meaning immunogenic po yung capsules ng strep pneumo. So our immune system can recognize this and make antibodies against it. So upon microscopic examination, we should be able to see gram-positive oval or lancet-shaped cocci in pairs, as we can see here in this picture. Okay, so notice po that they're not perfectly spherical. Okay, rather, yun nga po, oval sila or they're characteristically described to be lancet-shaped. So also, madalas din po na makita sila by twos. Their colonies are umbilicate and alpha hemolytic, but we'll get to that later, okay? So mamaya po makakita tayo ng pictures kung anong meaning when we say umbilicate. Streptococcus pneumoniae is well known as the causative agent of lobar pneumonia. So bacterial cells, once they reach and colonize the alveoli, they can stimulate an outpouring of fluid or excess fluid production, which serves to facilitate the spread of the organism to the adjacent alveoli. So magkakaroon po ng tubig sa baga or accumulation of fluid in the patient's lungs. So that fluid production would stop when the fluid reaches the fibrous septa that separates the major lung lobes. Okay? So this accounts for the lobar distribution of the infection, hence the name lobar pneumonia. So as shown here in this illustration to the right, pwede pong mangyari na iisang lobe lang yung infected and the rest of the lungs are perfectly fine. Next po, in children, strep pneumo may cause otitis media, and if the infection is left untreated, it may progress to bacterial meningitis. Bacterial meningitis caused by strep pneumo may also be typically seen in adults. So recall muna po tayo no, ng mga napag-usapan natin kanina. We talked about this earlier. If strep pneumo is a common causative agent of bacterial meningitis in adults, ano naman po yung strep species that is known to cause neonatal meningitis? Sige po, if you know the answers, you may type your answers sa chat box. Anong strep species po yung commonly associated with causing neonatal meningitis? Wala na nakalimutan na agad? It's strep agalactiae or the group B streptococci. Okay? So ayan po. If Streptococcus pneumoniae is a common causative agent of bacterial meningitis in adults, for neonates naman po, it's Streptococcus agalactiae. So Strep agalactiae yung common causative agent ng neonatal meningitis. All right, let's proceed to the laboratory diagnosis. So specimens that may be submitted for the diagnosis of strep pneumo may be sputum in cases of lobar pneumonia. Pwede rin pong CSF in cases of meningitis or blood if the physician thinks that the patient is also suffering from bacteremia. So the characteristic appearance of patients or appearance of the sputum sample from patients with lobar pneumonia has been described as rust-tinged sputum. So medyo kulay kalawang po. So it's kind of reddish, kind of brown. Their colony morphology on BAP may vary. So some are dome-shaped and mucoid, as we can see here in these examples. But most of them are characteristically umbilicate, meaning nakaangat po yung gilid niya tapos nakalubog yung ilalim, as you can see right here in these examples. So this colony morphology has also been described as coins with a raised rim. Ayan, coins with a raised rim. Now, one of the most important presumptive tests is the taxo-P or the optokin susceptibility. So if the isolate is strep pneumo, then it should be sensitive to the optokin disc. And this should be able to produce a zone of inhibition that is equal to or greater than 14 millimeters. So para masabi po natin na susceptible yung organism, the zone of inhibition should be at 14 or greater than 14 millimeters. So yan po yung taxo-P, which would identify Streptococcus pneumoniae. Another test that could help us identify if they isolate a strep pneumo is through the Neufeld-Kellang reaction. So basically, an anti-pneumococcal serum is added to the sample and is examined microscopically. So a positive result is indicated by capsular swelling as shown here. Okay, so nabanggit ko po kanina, di ba? The capsule of strep pneumo is immunogenic, so our antibodies could produce, or our immune system could produce antibodies against this. Okay, so ayun po, yun yung basis ng Neufeld-Kellang reaction. So kung sa unang microscopy po, nakita nyo na parang may mga capsules yung bacterial isolates, you may proceed with the Neufeld-Kellang reaction. So So ayan po, if strep pneumo nga po yung isolate, then their capsules should now appear enlarged or swollen, as we can see in this example. Let's now proceed to the virulent streptococci. So virulent strep are constituents of the normal flora of the upper respiratory tract. Okay? So, mas kilala po ang virulent strep as normal flora lang. Okay? They may be found in the respiratory tract. They may be found in the female genital tract. They may also be found in the gastrointestinal tract. So they're basically everywhere. And the term virulence actually means green, which would refer to the alpha hemolysis of most species. So karamihan po ng species ng virulent strep are alpha hemolytic. However, some beta hemolytic or a few non-hemolytic species have also been classified as virulent strep. So virulent streptococci are fastidious, and some strains may require increased CO2 for growth. So they are divided into 5 groups. Pero since hindi nga rin po sila ganun ka-clinically significant and they're not commonly seen in the clinical laboratory, ayan po, we would no longer be discussing them in further detail. Next is the Enterococcus species, which consists of gram-positive streptococci that are natural inhabitants of the intestinal tracts of both humans and animals. So the commonly identified species and clinical specimens are Enterococcus faecalis and Enterococcus faecium. So enterococci sometimes exhibit a pseudo-catalase reaction or just a weak bubbling in the catalase test. But take note though that they are still considered as catalase negative. The identification at the species level is based on biochemical characteristics. And in contrast to streptococci, enterococci have the capability to grow under extreme conditions. So kaya po ng mga enterococcus species na mag-grow in the presence of bile. Kaya nilang mag-grow in the presence of increased salt concentration. They could grow at 45 degrees Celsius, so medyo mataas na po yung temperature na yun for other bacteria. And they could also grow at an alkaline pH. Enterococci are frequent causes of nosocomial infections, and this includes UTIs being the most common and followed by bacteremia. So ito po yung dalawang pinakamadalas na diseases na associated with Enterococcus species. One of the most important presumptive tests in the identification of Enterococcus species is the bile esculin test. So other bacteria may be inhibited by the salt concentration that is present in this medium, but for Enterococcus, they will grow just fine. Enterococcus is also capable of growing in the presence of 4% bile and will be able to hydrolyze esculin to esculetin. So this reaction of hydrolyzing esculin to esculetin will then react with the ferric ions present in the culture media. So yung esculetin po na na-produce after hydrolysis or after dehydrolysis, ayun po, the esculetin would react to the ferric ions that are present in the culture media, and this would now produce dark brown or black precipitates. Okay, so pwede po natin gawin to on an agar plate or an agar slant. Okay, so ito po yung plate and then ito yung slant. Now, if the isolate is enterococci, then ganito po yung magiging itsura nila. So there would be blackening of the test media. All right, so on to the last segment of this discussion, we proceed to the streptococcus-like organisms. So ito mga susunod po, they're also not that medically significant. So we'll just go through them briefly. First up is Abioturfia and Granulicatella species. They are formerly known as the nutritionally variant streptococci. So nutritionally variant streptococci, these bacteria would grow as satellite colonies around other bacteria and they require sulfhydryl compounds for growth. So ang mga sulfhydryl compounds po, they're just basically sulfur that is bonded with a hydrogen atom. So these organisms are a part of the um, normal flora of the oral cavity and gastrointestinal tract of humans. Next is Enterococcus. So Enterococcus is a common, or Aerococcus, sorry po. Aerococcus is a common airborne organism, pero pwede rin naman po na ma-acquire ito through other forms of close contact. So this is a widespread opportunistic pathogen causing an increasing number of infections associated with bacteremia, endocarditis, and UTI in some immunocompromised patients. So Aerococcus viridans, this has been linked to cases of bacteremia and endocarditis. Aerococcus urinae naman po, this has been associated with invasive diseases that begin um, or originate from the abdominal lining, commonly found in the urinary tract. Aerococci may resemble viridans streptococci on culture, but in microscopic examination, they may be similar to streptococci in that they occur as tetrads or clusters, as we can see here in this picture. So karamihan po sila, sa kanila, naka-arrange by 4. Hindi katulad ng ibang streptococcus species that are arranged in chains. Di ba po? So in culture, kamukha nila yung viridan strep. Pero in microscopy, ayan po, mapapagkamala natin silang staphylococci because they are arranged in tetrads. Next is Gemella species. Gemella are similar in colony morphology and habitat to the viridans streptococci. They produce alpha hemolysis, but some of them may be non-hemolytic. And these bacteria may easily be decolorized upon gram staining. So they might appear as gram-negative cocci. Okay? So although classified po sila as gram-positive, minsan po masyado silang mabilis na ma-decolorize. So what would happen is they would take up the color of the counter stain better. Kaya napapagkamalan po yung mga gemella as gram-negative cocci. Lactococcus species are gram-positive cocci that occur singly, in pairs, or in chains, and may be physiologically similar to enterococci. So on SBA, these organisms can produce either alpha hemolysis or non-hemolytic. Next is leuconostoc, which consists of catalase negative, gram-positive microorganisms with irregular coccoid morphology. So although classified sila as cocci, minsan po medyo confusing yung shape nila. So these organisms share several phenotypic and biochemical characteristics with lactobacillus, viridans streptococci, pediococcus, and enterococcus. So minsan po pwede silang ma-confuse with all these other species. Last one is pediococcus. So they are facultatively anaerobic, gram-positive cocci that can grow at 45 degrees Celsius. So para silang mga enterococci, no? Kaya rin nilang mag-grow at higher temperatures such as 45 degrees Celsius. So they may be misidentified as viridans strep or enterococci. So ayan po, here are the references that were used in the making of this discussion. Thank you so much po for listening. Our chat box is now open for questions. So does anybody have any questions po?